Hello, I am Sarah and this is Teresa, and today we will be discussing how to use a vein light. The vein light is a transilluminator for easy vein access. The first thing that we're going to do is gather our supplies. We need our hand sanitizer for proper hand hygiene. We need an IV start kit. We're going to need some alcohol pads, your Sani wipe, your saline to prime your extension, your extension set, the catheter that is most comfortable for your patient, your vein light device, and a set of clean gloves. So prior to setting up my sterile field, I'm going to have Teresa wash her arm with soap and water or hand sanitizer and allow to dry. This gives us a clean working area for our peripheral stick. So now that Teresa has washed her arm, I'm going to go ahead and perform hand hygiene. I'm going to take out my peripheral kit and open without touching the interior of the bucket. I'm now going to set up my extension set and prime that. As long as I do not touch my needleless connector, I can go ahead and connect. If you do accidentally touch your needleless connector prior to connecting the saline syringe, go ahead and scrub it with an alcohol wipe. So now that I have my extension set primed, I can go ahead and set that aside. And I'm going to open up my catheter. So now I'm going to go ahead, remove your sterile gloves and set those aside. I'm going to take out my sterile drape and place underneath Teresa's arm. I then can go ahead and take out my garbage bag and set that aside and take out my tourniquet. And place that around Teresa's arm. I'm not going to tighten it yet. I'm going to get my vein visualization device or my vein light ready. To do this, I'm going to open the kit. The vein light should be cleaned prior to being placed into the package. Along with the vein light, I'm going to want to take out the plastic covering that goes over the vein light. I'm going to go ahead and place the vein light into the protective cover. And close that up. Prior to use, I'm going to take an alcohol wipe and clean the protective cover wherever it will touch the patient's skin. I'm going to set that down and allow that to dry with the clean side up. I am now going to place the tourniquet 4 to 6 inches above the intended stick site. Remember to check to make sure that it's not too loose or too tight. From here, I'm going to perform hand hygiene. And apply my gloves. So now that I have my gloves on and the tourniquet is reapplied, I'm going to go ahead and retrieve my vein light device, making sure that I am not touching any of the area that I've cleaned previously with alcohol. I'm going to depress the orange button on the side. And to start off, I'm going to go lateral with the device from right to left or left to right until I'm able to visualize a vein. If you're not able to visualize a vein the first time around, go ahead and redo that, working your way down the arm. So once you locate a vein, you will notice that the vein is darker appearing line in the lighted area. From there, I can track that vein down the arm and select the appropriate site to place my peripheral catheter. Once I have that site selected and there's no bifurcations, I can rotate the device so the opening of the device is pointing away from the heart. At this point, if your patient is able, you can go ahead and have the patient hold the device with a gentle pressure and upward motion, and that will provide traction to that vein and prevent that vein from rolling when the time comes to place that peripheral catheter. Now that she's holding that, I'm going to retrieve my chlorhexidine swab, snap it, and clean the intended site of insertion with the chlorhexidine solution. Remember, chlorhexidine works by a scrubbing motion for a minimum of 30 seconds. Once I have cleaned all the skin, I'm going to allow it to dry naturally. So now that we've allowed it to dry, I'm going to go ahead and retrieve my peripheral catheter. And I'm going to insert it at a 10 to 15 degree angle. Please refer to our peripheral catheter insertion video for insertion technique and how to place the peripheral dressing. Please note that you will notice that there is a difference between our peripheral IV video and the technique we used here. This is a clean technique, therefore we should not repalpate the site after we have cleansed it. So now that we have the dressing on and the catheter is flushed, I'm going to clean up my supplies. And discard as appropriately in the household trash or otherwise specified. I'm going to remove my plastic sheath for my device. Throw all of our used supplies and remove our gloves. Anytime you've removed your gloves, you're going to want to go ahead and perform hand hygiene. I'm going to want to take my clean set of gloves I'm going to retrieve my PDI Sani wipe. And cleanse my device. Please follow the manufacturer's guidelines and recommendations for cleansing of all devices. Please allow the Sani wipe solution to dry prior to placing it back in its package. Once again, gather all of your used supplies, remove your glove and discard in the trash, and perform hand hygiene. And always make sure your patient is in a comfortable position and that they are having no pain or irritation with their peripheral catheter. This concludes the vein light video. If you have any questions, please let us know or visit our website. Thank you for watching.